I'm Cristina Vidal. I am assistant professor in the Department of Operative Dentistry at the University of Iowa College of Dentistry. In the Operative Dentistry graduate program, the residents develop their research projects in various fields related to operative dentistry. We have a strong group of researchers working with cardiology and biomaterials, but we also have collaboration with other researchers at the College of Dentistry, College of Medicine, College of Pharmacy, and College of Engineers. With the development of the research projects, they learn new techniques, they learn new methods, and they work on specific topics that will help them to make better decisions in the clinic. In the first year, the residents start doing literature reviews and discussing possibilities for their research projects. So they have multiple interactions with all of the researchers in the department, all the faculty in the department, and they first try to identify what is the topic of interest for them, and then we are try to match them with the faculty who will be the best mentor for them in their specific project. The residents also work together with the Division of Biostatistics and Bioinformatics, who guides them and provides support for all the statistics in the research design, in developing the hypothesis and data analysis and data interpretation. They also work together with other collaborators that can be from the department, from other departments, from other colleges across the campus actually. In some cases, the residents start the program and they know exactly what they want to do. In that case, we will try to better define the idea and help them to formulate the project and the goals for that project. In some situations, the residents don't have research experience and they don't know exactly what they want to do. So we present to them what are the ongoing projects and the research interests of our faculty, trying to match them with a specific research area or with a specific mentor. There are different types of projects that the students develop in the program, from in vitro studies, where they work mainly at the lab. In some situations, they work with patients and they conduct human subjects research, and they might participate in clinical trials in very specific situations. The students are encouraged to present the findings of their research projects at local and national research meetings. They also are encouraged to publish the results in a peer-reviewed journal, and we have resources to help them with that. So we have seminars and sessions where we can prepare the presentations with them, and we do rehearsal of those presentations so they can practice. The research and the clinical activities and teaching activities are well coordinated in the program. The students participate in courses where we have lit reviews and journal clubs to discuss many different relevant topics in operative dentistry. And with that knowledge, they get more prepared to first develop their own research project at the lab because they learn new techniques and protocols. Second, they also get more prepared for teaching because we want to teach evidence-based dentistry, so they know more about the literature and what is the evidence for all the protocols and materials and all the decisions we make in the clinic and all the protocols and materials that we use. And they also get more prepared for their clinical practice, in terms of explaining to the patients what are the options for the treatment plan and what is the evidence to support those decisions and those possibilities for treatment. Operative Dentistry has the Operative and Biomaterials Research Lab, where we have supplies and several equipment for sample preparation and testing of different materials, different substrates, where the students conduct and develop most of their experiments when they are working on in vitro studies. We also have the Iowa Institute for Oral Health Research inside the college. So in some specific cases where we don't have equipment that is needed for the residents here in the college or in our Operative and Biomaterials Research Lab, we have other research labs and other core facilities that we can use. Scanning electron microscopy, transmission electron microscopy, confocal microscopes, and many other equipments that we can use for characterization of materials, evaluation of mechanical, physical properties, and many other possibilities. The faculty in the Operative Dentistry department work on many different projects sponsored by industry, by foundations, by professional associations and organizations, and also by federal agencies. So with that support, we are able to work together with the residents in many different projects and use those resources to be able to develop their experiments. In some situations, we also have some initiatives in the university and in the college. So some of the residents may apply and receive funding specific for their thesis and for the development of their research projects. To me, the most rewarding aspect of working and developing research with the residents is to see how much they learn and they grow. A lot of protocols, a lot of techniques, and by year 2 or 3, they are very independent at the lab, working together in experiments and improving and optimizing protocols so we can test new materials, we can develop new strategies that can be hopefully translated or incorporated into the clinical practice.